Physiologic response, again, you have an increase in your heart rate, you have an increase in your blood pressure, you have an increased blood flow to your muscles, so you shunt blood away from your vital organs, you have decreased blood flow to your skin, you feel cold, you get goosebumps, you have an increased metabolic rate, you have decreased digestion, you have increased blood clotting and thickness. None of this is favorable for health when it's prolonged. You have increased blood sugar, you have increased respiratory rate, you actually only use the top 2/3 of your lungs, so a lot when you're anxious, and just remember when that's happened to you. You have increased fluid retention, you do increase your alertness temporarily, but then you have a fatigue factor set in, and you have increased triglycerides and LDL cholesterol. Now, the fight or flight reaction kicks in even when there is no life-threatening situation, and it is sufficient for us just to feel threatened. And unfortunately, in our modern day life, hyperarousal can become a permanent way of life. And I think we have enough information now to know that biochemically speaking, that's a disaster. That's not a healthy way to go through the world. What are the symptoms? Anger, hostility, irritability, particularly with those who are closest to you and won't walk away from you, anxiety and depression, decreased memory, decreased focus, as Mr. Robinson has said, inability to relax, and significant disturbed sleep in this country due to this result. Now, what about anger and myocardial infarction? Again, 1,623 patients were tracked, and they came into the emergency room, and we asked them, well, what's happened in the last couple of hours? Anger increased the risk of having a heart attack by 230%. 230%. And I've seen this over and over again in my 20 years as a cardiologist. I had an argument with my son. I had an argument with my daughter. I was stuck in traffic. I had an argument with my boss, and suddenly I developed chest pain. Anxiety. 2,280 patients followed for 32 years. There was a 5-fold increase in sudden cardiac death. Here you are, there you are. You have, the medics are calls, you've had what we call ventricular fibrillation. It is a rhythm disturbance that is not compatible with life. And this is when this was controlled for all those other factors that we already know about: smoking, high blood pressure, diabetes, and whether or not you're male or female. What about depression? Depression is a very serious complication of a myocardial infarction. Probably 60% of patients do suffer from some sort of depression following a myocardial event. 75% of the post-MI deaths were related to depression within the next 6 months. This is a very, very powerful biochemical mediator for preventing proper healing when one has suffered a myocardial infarction. And again, independent of other risk factors that cause the heart attack in the first place. But depression in itself can make you prone to a heart attack, as seen in this slide. 4,400 women and over 65 years old who had no coronary artery disease at baseline. They were followed for 6 years. Every increase of 5 points on the depression score category increased their risk of developing cardiac disease and of dying from cardiac disease. So again, the profound nature of this change in your biochemistry cannot be overemphasized. And what do we do also? Even when then we look for ways to feel better, right? And most of us don't choose broccoli. When we're feeling bad, we don't go for those antioxidants in the green vegetables. We overeat, we overwork. We try, if I can only get this done, then I'll feel better. We isolate ourselves, and we don't reach out for anyone to comfort us or to buffer our agitation. We don't sleep well, we are exhausted, and we practice, some of us can practice addictive behaviors. Well, the obesity epidemic in the United States is a factor of this, and you can see just in our own state from 1991 to 2000, over 10 years, we have gone from less than 10% obese, that is someone who's more than 30% over their ideal body weight. In men, that's a waist circumference greater than 40 rather. In women, it's a waist circumference greater than 35 inches. And we've increased a full 10%, and I can tell you that in 2010 we will be a red state with obesity. What about the factors of social isolation? If you're feeling tense and you don't, angry, irritable, overwrought, and you isolate yourself. Prolonged social isolation is as significant as smoking a pack of cigarettes a day. well documented. And it is an independent predictor of mortality in men who have that so-called type A personality. This is a study from Alameda County, again published in the 1980s, but 7,000 men and women followed over 17 years. Those who lacked social contact, did not have regular friends, relatives, church, or social groups, had a threefold higher death rate within that 17-year period than those. And they had similar age, gender, race, smoking, overeating, physical inactivity, and alcohol consumption. The power of social contact, the power of reducing your stress.